I think that's an affirmative. All right, good morning. My name is Jack Overneer. Welcome to the July 17th meeting of the Incarceration Prevention and Reduction Task Force. This is a hybrid meeting. Before we begin, I'd like to read our land acknowledgement statement. So before we begin, we acknowledge that we are gathered on the traditional and unceded territory of the Lummi, Nooksack, Samish, and Semiahmoo people who have cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort to acknowledge what has been buried by honoring the truth. We pay respect to their elders, past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us together here today, and please join us in uncovering such truths at any and all public events. All right, well, I'm calling the meeting to order. Barry, if you're available, I wanted to quickly mention too, we received some information from Karen Frakes that I want to quickly just give a slight touch on. And basically, I'm pulling that up. Yeah, there we go. We need to be mindful. I'm supposed to announce that open public meetings during an election season, we need to caution the attendees and the legislative bodies not to speak in support or in opposition to political campaigns during a number of open public meetings. So I'm specifically referring now to, because this group has been very involved in many of the things that are now with the county ordinance relating to a potential tax that we can't have comment on. Have I captured that somewhat appropriately, Barry? I know we don't have a formal statement yet.
Yeah, we just started working on this, Karen and I and our staff from the council office, and we informed the executive's office as well about how to do this and what things we have to avoid. So we're kind of new to this game this year anyway, but we do have to be careful about the promotion or the opposition of any measure that's on the ballot this or any November actually. So once things go to the ballot, we have to be careful what we say. So we're going to be extremely careful today since we don't have all those guidelines laid out quite yet. So when I give my report, I will keep it very brief, and we'll talk about probably what's most relevant to our work, which is the formation of a committee to support this. So Jack, I'll turn it back over to you.
Cool. So yeah, if you see us trying to kind of navigate that, we're a little new to it. We know we need to be mindful of it, and I just wanted everyone to be aware that that's going on in the background. So with that, actually, Perry, it's like pickleball or racquetball or tennis. The first topic is the Justice Project Implementation Plan, which is the task force acting as the Law Justice Council. And I'm going to let you start that off if you would, Barry.
Okay, so we have landed that airplane as far as getting the ordinance approved by the council. The council approved it last week, and it will now go to the November ballot. One of the things that has come out of the implementation plan is the JPOP, which is I'm not good with that acronym quite yet. Justice Project Operations Performance. It's an oversight committee at any rate that deals with the operations side. We also have a finance committee that's separate from the JPOP, but the JPOP will be a subcommittee of the Incarceration Prevention Reduction Task Force. So that is something that in the coming months we will be looking at creating a framework of how to create the process that we want to use. We'll have to wait till after the election to actually do it, but we can work on at least kind of the policies and the procedures and the charter of that group. And so you can expect to hear a little more out of steering about that. Really, Jack, that's all I have to report on the Justice Project this morning.
Okay. Are there any questions about the status of that? Okay, thank you, Barry. Perry, I knew we were going to call on you just to kind of do some follow-up on where we're at on the Crisis Stabilization Center and Deacon Center for Hope, kind of follow up on our discussion last month. Would you be able to do that for us now? And I think you're also doing the quarterly census as well, if I'm not mistaken.
Indeed, that's accurate, Jack. Thank you. Perry Mowry, I'm the Response Systems Division Supervisor, a component of the Health and Human Services Department. Wanted to talk just a little bit today, and I'm going to share my screen as well here. Hopefully folks can see that, and it's large enough to be able to see. This is just data that I receive from our providers. Pioneer Human Services provides detox services at the Crisis Stabilization Center and Deacon Center for Hope, and Compass Health provides the mental health stabilization. I started up here at the top with detox services, and just again wanted to provide some real basic information in a little bit of comparison for quarter one and quarter two of 2023. I highlighted in blue quarter two just so that folks could see it a little more quickly. We had a total of 1,456 bed days during this last quarter, the second quarter. The utilization of beds, folks will recall that there are 16 beds in detox and 16 beds in mental health stabilization. So the utilization of beds was 1,167 beds utilized. It's at an 80% bed utilization, which I feel is a pretty solid number, pretty positive number. There's actually a total of 250 unduplicated individuals served. And we receive referrals, and I'll get into that detail a little bit, from a number of different entities. But during this quarter, there was 637 referrals received. 9 were from law enforcement. 1 was from emergency medical services. We didn't receive any from the LEAD program, but received 2 from the GRACE program. Mobile Crisis Outreach Team also referred 2 individuals. That tends to be, their referrals tend to be more predominantly for mental health stabilization than withdrawal services, but I'll share that. We get a number of referrals from Peace Health, a total of 42 in this quarter, and other professionals that obviously can refer as well. We had a total of 86. Our highest number of referrals come from self and families, which makes sense, that individuals call the facility directly. There was 475. And Base Camp referred a total of 20 that were provided services. And so a little bit of help that can go on here. If you look at this upper number that is not in blue from quarter one, a little bit of comparison in, the changes that had occurred. We had a few less referrals, interestingly enough, in quarter two than we did in quarter one. And then you can compare across that. Hopefully, that's as clear as possible. Again, when I was making reference to Base Camp, there was in quarter one a total of 4 individuals that were referred, and in quarter two there was a total of 20. So just some basic information down here at the bottom. I put in highlighted in yellow and in red. Those are totals for the 2 quarters. So it gives us again, a snapshot picture of the services that are being used. So let me drop down. I'll move this up just a little bit for clarification. This is mental health stabilization services, again, highlighted quarter two in blue. And of course, there were the same number of program bed days for both detox and the facility. That's just 16 beds times the number of days that are available in the months. 948 utilized bed dates, which was a 65% utilization, actually down about 5% from quarter one. They did have similar numbers for unduplicated individuals served. They did actually have a higher number of referrals that were received than were received in quarter one. They did receive 12 referrals from law enforcement, which is good. That number is actually up from quarter one. EMS referred 4, LEAD 2, GRACE 2 as well. MCOT, as I noted earlier, typically refers to the mental health stabilization side, as that's the work that they do more commonly. So we had 12 from MCOT. Peace Health had referred 105 individuals from their facility. The jail also refers individuals. Oftentimes, individuals are stabilized at the mental health stabilization facility in the process of transferring to inpatient care for other services. So they do provide that service as well. Similar numbers for other professionals that referred. Self and family was actually up during Q2, and base camp actually referred 10 as well. And so again, those numbers in yellow are just the total for Q1 and Q2. We're at actually about a 68% utilization, which I'd like to see higher. I'll talk about that in just a moment. Some of the steps that we're taking there. And again, the unduplicated served and et cetera. I'll stop here. Jack, are there any comments or questions specifically before I take this particular screen down? Because I have some other screens that I want to share.
Sure, we have Mike Parker.
Good morning, Perry. Thank you so much for the data. That's it's partially telling, and it made me kind of wonder about a couple of context things. So I'm curious if there's anything in your knowledge of how the program has been operating this first half of the year. Like, are they at full staff, for example? Sometimes facilities we may hold to some standard, but they may not be at full staff. So I'm curious if you could comment on staffing levels and if they were considered more or less normal. And then if you have any data, the other piece that I was really curious about, especially in the last part where you were talking about mental health stabilization, there's a big gap between the referrals received, I guess, there, and then the unduplicated served. And I'm wondering if you have any information to share with the task force about that difference. Like, what are common denial reasons, or is that part of what you're digging into further? Thanks, Barry.
No, those are great questions, Mike. Thanks so much. And there has been some staffing additions that have occurred, as well as training that goes along with that. During both Q1 and Q2 for actually both of the providers. But I wouldn't say that I have understood it to be, an overarching issue as far as staffing. That's beginning to settle down. I'm feeling really good about that because, obviously there's a fair amount of training that goes on for individuals that are working at the Crisis Stabilization Center on any number of levels. And so it's a real loss when individuals do leave for, other positions, that sort of thing. Also, Compass Health has added 2 additional staff that are actually required by certification for our 12-hour law enforcement hold. I'll get into that a little bit, but they do have those positions staffed and trained now, which has been an important step as well. I can't speak, and I can dive into this a little bit because it's actually a great question, Mike, just relative to the referrals received and the unduplicated individuals served, that I don't have a breakdown in terms of that. As much as I can certainly speak to what are some of the challenges and what are some of the reasons that individuals are not admitted when referred to the facility. It can be any number of things that we do track a little bit of information of individuals that chose not to follow through with the referral and some other pieces. But I will also step into that. And I'll do so here. I'm going to stop sharing this particular screen, and I wanted to share another one that let's see, how do I approach this? Well, I think one of the things that I'll do here, instead of just sharing it, I'll just read off some of the notes that I made for myself relative to, we've been in, I think that folks are aware, we have a monthly Crisis Stabilization Center Advisory Committee. In that committee, the providers certainly attend, as well as law enforcement. Both county and city law enforcement attend that monthly meeting, as well as fire department and EMS. We do have some other individuals that are knowledgeable individuals relative to detox and mental health services in the community that do attend. And So there's a couple of things that we do within that meeting, talk specifically with the attendees about challenges that they are facing, resources they might need, et cetera, that is discussed. We also, and I think I've mentioned this before, we utilize an online systems improvement form, which I found to be very helpful. The detail that is provided, that form can actually be found on our county website pretty quickly. When that form is completed by whomever, it can certainly be completed by any individual that that chooses to. It gives me enough detail, and actually the form itself is forwarded directly to my email as well as the email of my supervisor, Moore Christensen. And then we address those during the meeting as well to just to talk about challenges that have gone on, et cetera. Some of the other things that the providers and the county action steps that we have recently put into place, just in regard to wanting to further develop the referrals from law enforcement in particular. So we want to pay really close attention to those numbers to see if the action steps that have occurred improve that referral base from law enforcement itself. Pioneer Human Services is now providing a daily bed availability. They actually provide that to the Response Systems Division, and then that is forwarded out to our partners and other stakeholders that utilize the Crisis Stabilization Center. Both Pioneer Human Services and Compass Health also have continued training with staff. We were really focusing on trauma-informed care and low barrier orientation with staff towards incoming clients. This was actually something that was recommended through some of the systems improvement forms, which was very helpful, and the providers responded very quickly to that. Also, at this point, and it's data that I need to begin to collect, and I have some meetings set up with the providers at this point, of that both Pioneer Human Services and Compass Health staff, structural staff, the upper structure staff, actually review admission denials. And I'll talk about that just a little bit more in detail. But that's something that they've done in terms of an action step to actually review denials and what the reason for those denials were. Compass Health also is completing a survey with individuals that are discharging clients for quality improvement. They found that individuals were, in some of their data, were leaving the facility earlier than what the recommended length of stay, which is typically about 3 to 5 days. So they had individuals that were leaving the facility earlier than the recommended time frame, and so really went about implementing surveys to understand further of why individuals were choosing to leave the facility prior to recommendations of the staff. As I mentioned, also as part of an action step, Compass Health has hired and trained additional staff for the 12-hour law enforcement drop-off that we do have availability for now. The other thing that Compass Health did, and it was a little while back, but they rescinded their non-smoking policy. It was a little bit confusing or challenging. The providers, Pioneer Human Services, did not have a non-smoking policy, and Compass Health did have a non-smoking policy when individuals admitted the facility. There was a bit of conflict, obviously, between the two locations, and people recognizing that some individuals were able to smoke and others were not. So at any rate, Compass Health rescinded their non-smoking policy. That's now allowed. Obviously, as I mentioned, our Crisis Stabilization Center advisory committee meeting on a monthly basis with the individuals that that I mentioned that are represented. And something else that I'm going to share here in our last meeting, I put together, with the help of the providers as well, just to make sure of accuracy, a law enforcement first responder advisor card, and I'll show a copy of that for clarification to our law enforcement representatives and first responders, just for clarity in terms of allowable admissions, components and issues that would cause an individual not to be admitted, and et cetera. And again, I'll put that up. And I'm continuing to get online systems improvement forms as well. That again is really helpful for me in that detail. I can follow it up. What I typically do when I receive notification of a systems improvement form is I'll call the individual, maybe gather some additional information in detail, and then I forward that and have a discussion with the supervisors of whichever side it happens to be pertaining to. So a super helpful, and obviously we keep those as well so we can do some tracking in that regard. So let me also share here. Hopefully folks can see that and can make it maybe just a little bit larger. This is a double-sided card. The intent again, in terms of printing it, I'm prepared to print it at this point on heavy stock. We'll probably laminate it to be handed out to, obviously, again, our law enforcement and other first responders. The left side is just general admission considerations. And I think this goes back to Mr. Parker's question of what reason are there, what are the reasons that an individual might not be admitted to the facility? And I think that it speaks to this. Obviously, it's a voluntary facility. We've talked about that before. It does, the individual must be an adult, 18 years of age or older, and conditions requiring a private care physician or emergency department include the individual requires an emergent primary medical. There's oftentimes a misunderstanding that the staff at the Crisis Stabilization Center can provide primary medical care. It's not accurate. They're not licensed for that, and so they're not able to provide that type of care, wound care, other kinds of things. Individuals in need of IV fluids, they're not able to do IV fluids or IV medication. If the individual is required that, they would be referred to the emergency department or a physician. Individuals with active seizures that are occurring, if this is occurring and they don't have medication, that's another piece. And also individuals with unstable vital signs, obviously blood pressure, those sorts of things of where we want to make certain that the individual is safe in order to be admitted to the facility. And so they will do some basic vital signs. And if the individual exceeds those, medically established vital signs, then they will have them stabilized at the emergency department prior to being admitted. Other conditions that require a higher level of care, individuals that require oxygen. That is individuals that are on permanent oxygen. They can't allow oxygen tanks into the facility. And again, this is a licensing situation. And also individuals that are unable to independently complete 5 activities of daily living, or what we refer to as ADLs. And those are listed there, obviously: bathing, dressing, transferring, being able to move, toileting, and eating unassisted. The last piece is behavior must be suitable for group living. I think that folks are aware that the Crisis Stabilization Center is an open milieu. And so there are other individuals they're interacting with, and et cetera. And so physical aggression, combativeness, or an immediate history of that is a concern just relative to the individual's safety and safety of other individuals that are currently receiving services, and then able to engage in treatment and care planning. Those are a little more, open to interpretation. I know that the staff are, continuing to orient towards that, et cetera. So again, that left side is a very general framework for, anybody that was, taking a look at the Crisis Stabilization Center. And utilization of that. The other side, obviously, these will be folded together so that they're back to back. And when they're printed, but this is for law enforcement specifically for quick reference and drop off. Obviously, the phone number, and then it walks down through the steps that the law enforcement first responder can contact the facility, and then there is an extension for mental health triage and or detox that's listed there. And the protocol that has been set up is that the staff, as they receive the call and the individual identifies themselves as law enforcement or first responder, that they ask 5 basic questions and it ties back into some of the things that I was talking about before. The client's date of birth to establish that they're an adult, the current presenting concerns that the officer, deputy, or other first responder is experiencing. If the individual has a blood alcohol level of 0.25, detox actually accepts a 0.35 detox level. And so, we establish that. Sometimes law enforcement doesn't have that information, and they will do a breathalyzer with the individual at the point in time that they bring them to the facility. And then whether the individual requires oxygen, again, just trying to save time here as far as the law enforcement bringing the individual to the facility, and if they are able to meet their activities of daily living. And then to the reference knowledge, has the client been convicted of arson or are they a level 3 sex offender? There's a clarification that this is not a disqualifier, but it guides the planning, for the crisis stabilization staff. If they're combative, threatening, and also that then the last component of it, law enforcement first responder can transport to the crisis stabilization center. So effectively what's happening here is just doing a real quick run through and also establishing that there is an available bed to limit the time that law enforcement or other first responders would need to be involved. This, ongoing question of how quickly can a drop-off occur, and et cetera. I'll go ahead and take this down unless there are specific questions about this one, and we can have further discussion.
Mike, go right ahead.
Perry, thanks. Yeah, just a quick clarification. You mentioned some specifics about blood alcohol level. How are you handling other types of intoxication, maybe methamphetamine, fentanyl? Are there any specific barometers or indicators that you're asking of law enforcement prior to a drop off for somebody on different substances?
Mike, you're really dialed in because this is a super important question that has, obviously in the, increase in opioids, fentanyl, et cetera, it's a real concern for the individual safety, as well as obviously the liability of the providers in admitting an individual, because they can't do an immediate screening other than, questions. And sometimes individuals are not real accurate historians relative to the substances that they may have on board. And so that has been a step in real caution in terms of evaluating the individual and their responsiveness with concern and in regard to what substances they may have ingested prior to the admission process occurring. And so they're really taking that on a case-by-case basis. And if the individual doesn't appear to be, lucid and functioning and et cetera, some caution in terms of saying, let's have them checked out and let's do a screen at the emergency department. Obviously, as little as possible because we want to admit the individual, but that balance as far as an individual possibly coming into the facility and then overdosing, at that point in time. Not that the staff can't respond to an overdose with, the materials that we're all pretty familiar with, but if at all possible, not putting the individual at risk of overdose in that fairly brief period of time that the substances will be in the system. So really great question, and it's been an ongoing discussion with the providers just relative to the changing world that we're seeing relative to the substances that are more common out there. We haven't seen signs of xylazine. I think that folks are aware of tranq and that terminology. But I just did have some conversations about test strips that may be available and wanting to support the providers, in that regard. So yes, it's a much more sophisticated world of substances that are out there and individuals that are in a crisis in relation to that, and that balance between keeping them safe and also being able to provide that service. So it is definitely an impact in terms of immediate admissions prior to taking them to the emergency department. So great question, Mike.
So Perry, if I could, just to make sure, I'm just reflecting understanding. So a lot of times in those situations, if it's kind of unclear, if the person's a little slurry, the first step's still going to be the hospital to kind of do a medical clearance and to see what's on board. At that point, though, would become a referral from Peace Health. Would that be correct? And it might show up on your chart. Maybe it began as a law enforcement attempted drop off. It really became clear that person needed to be checked out medically. They go via the route of the hospital. But they still might wind up at the facility. Is that kind of a way we could understand that process flow for
Oh, absolutely.
non-alcohol related type of individual? Okay.
Yeah, absolutely. That is the intent, as a matter of fact, and communication actually begins between the hospital and the Crisis Stabilization Center, which has really been developing, and I've been appreciative, in that regard, as well as something that I didn't mention here, is it's sort of a little bit off to the side. The Response Systems Division has been having regular meetings with the hospital and the emergency department, just because there is so much back and forth. It's not limited to simply the Crisis Stabilization Center, but also into discussions relative to law enforcement, drop-offs at Peace Health relative to psychiatric needs, those sorts of things. But it's a great venue and an open opportunity to understand, because the director of the emergency department and other individuals, the psych nurses and so forth, are in that meeting. And I think that's been a really important addition, that we have that regular meeting, whether it's Crisis Stabilization Center or law enforcement or others. So there's representatives of EMS, law enforcement, and a fire at that facility, as well as with obviously the county. So, yep, some on-point questions, Mike.
Thank you, Mike. Raylene?
Thank you. Perry, what are the chances or possibilities of changing the licensing requirements to open it up to more individuals that can't be admitted now currently?
Fairly limited, because the providers are licensed at the at the level of a residential treatment facility. This isn't necessarily part of the discussion here, but I have hopes relative to, and I know, Raylene, that you're cognizant of the plans for development of a 23-hour crisis relief center. So I don't want to confuse, terminology. Now, the 23-hour crisis relief center, at least as I understand it in the legislative language, will be able to, as a matter of fact, there is a no refusal policy for that setting, and it does have a different staffing level in terms of an individual that is able to prescribe psychiatric medication. Not true for the Crisis Stabilization Center. They can assist with that, but not prescribe. And also primary medical that can address more severe medical conditions. So it's my hope that one of the things that's going to happen, and again, 23-hour crisis relief center is, a pretty good description, in the sense that an individual can stay for that length of time. That hope and communication being between the Crisis Stabilization Center for those individuals that come into the 23-hour center that are open to going into withdrawal management services or mental health stabilization services. And there's a bit more time to be able to work with those individuals, because I think that some of the times that, honestly, what happens is people are afraid of what will happen at the Crisis Stabilization Center, that they'd be locked up, or that, that something terrible would happen. And so their fear actually stops them from being willing to admit. And so if they're interacting with individuals that are closely working with the Crisis Stabilization Center and realize, oh, these people are here to help me, they care, they're, connecting with me, etc., that it will increase that likelihood of admissions. And of course, we have the advantage of that 23-hour period of observation prior to that, with some stabilization and so forth. So I think the combination of those two services will address, I'm making some assumptions here, and I don't mean to, but will address that concern of, well, can we increase the certification and licensure for the facility to admit those individuals that that are possibly being not being admitted due to whether it's oxygen or or other ADLs, that sort of thing. So great question. Hopefully I answered your question, Raylene.
All right, any other questions?
So I'll wrap it up. Jack was saying that my intent now is to have a number of these Pfizer cards printed and laminated and so forth, and then give them out to law enforcement and first responders, but also put together just a very brief. There's some opportunities to work with and speak to law enforcement in some of their established meetings to also then communicate this. But there's obviously a visual along with that, so that questions can be asked and so forth. I've reached out to some smaller cities law enforcement that honestly had experienced trying to work with the triage facility in the past and had not had great experience with that, and had drawn assumptions that the Crisis Stabilization Center was the same thing. And so some additional information was helpful to provide to those individuals. And I think that I need to take responsibility to do more of that to increase the response of the law enforcement to the Crisis Stabilization Center. So I'll end with that.
So Perry, I just a couple quick comments. When Stephen and I presented to Bellingham City Council last Monday, the Crisis Stabilization Center was certainly a topic they were interested in. They were particularly interested in some of the data, and I told them that we were continuing to fine tune that. I think the county council had some similar questions. I remember Jill sending some data out. So I just wanted to communicate that that is information that we're getting asked for, that people seem interested in. I don't know. I don't want to pick on his Dan. Yeah, Dan. So I don't know if Dan wants to add anything to that. But anyway, so I wanted to mention that. Also, I think most people know what base camp is, but I wanted you to quickly tell people. You have quite a few referrals from there. I'm not sure that everyone on this call is familiar with base camp, so I think that could be helpful. And then if there's another question, so we'll move on.
Sure, absolutely. I'm by no means an expert. Mr. Parker may be able to help me out here some, but base camp is a shelter that's located in within the city limits of Bellingham. There is a lot of interaction with base camp, with the response systems division that I'm a part of in the Health and Human Services, just in terms of addressing individuals' needs, social determinants of health. Many individuals that are involved with GRACE and LEAD, for example, in the response systems division are homeless. And so a lot of interaction and involvement occurs there. I'm particularly proud of those particular numbers because the premise, or how do I say this? Some individuals believed that individuals that were base camp attendees were actually refused services at the Crisis Stabilization Center because of their homeless status and or their involvement with base camp. I didn't believe that that was true, but others, had some concerns about that. So seeing those numbers increase is something that that I feel really positive about. Don't mean to take control, Jack, but if Mike has other information about base camp, I'd be thrilled.
Oh, Perry, I think you hit it. I mean, the only thing to add is that, I think their daily bed count census is over 200 humans a night at their facility now in the old public market as they construct a new building, and that is operated by Lighthouse Mission. So obviously people are there voluntarily, right? But they deal with folks, with all comers, and they have, what we hear from them is they too work to lower their barriers. But obviously their staff is going to get stretched. So having something like this can help really another 190 folks, right, stay more safely at night. So I'm also pleased to see that, Perry.
Great, thanks everyone. I think with that, are there any other questions for Perry regarding the Crisis Stabilization Center? All right. We're going to move on to the next agenda item, which, Mike, this will involve you, and this is a discussion, I think a review actually, of the role of the steering committee document that is in, and I believe an approval of it, it's in your packet on page 8. Mike, would you like to introduce this and explain what this is, please?
You bet. So I'm a member of the steering committee as the co-chair with council member Dan Hamill of the Behavioral Health Subcommittee. And in a role in the steering committee, we not infrequently, at basically every meeting, we talk a little bit about the Government Alliance on Racial Equity. And one of the things that forced us in steering to do is look at, are we being transparent? Are we being true to kind of our mission? Jill Nixon helped us look back, and we realized that the steering committee in the beginning was really just kind of doing agendas. And I don't mean to minimize it, Jack, and since you were here since longer ago, you can help me characterize, because that's pre my time. But it had a very specific and narrow charter for the steering committee. And as we looked at that, and with goals of increasing transparency and understanding, we realized that we were operating really outside of our bounds. So Jill, if you wouldn't mind sharing the screen with the language that the steering committee is bringing forth today to share with the task force as a whole. This is what we'd like to do. So I guess, Jack, I think the best way that I can clarify this, and chime in, please, if I've got this off, is really more of a clarification of things that we do. This isn't really adding any new tasks to the steering committee, but we did think that it was necessary to bring forward kind of how we're actually operating, and then obviously get the approval from the task force, because the task force is the one, Jack, if I'm not mistaken, that really delegates to the steering committee these various roles. So before I present some wording that we kind of wordsmithed in the steering committee, I'll go ahead and just read it briefly. It's pretty short, but the mission of the IPRTF steering committee, in coordination with the task force, is to create agendas, explore topics and issues, and recommend activities or areas of focus to be pursued, carry out task assignments delegated from the task force, assist with moving the work of the task force and its subcommittees forward, assist with public communication, and respond to inquiries and coordinate responses. And you can see the kind of bulleted list with some specifics, which could include working with contractors like Pyramid Communications, coordinate with support with county staff for yearly task force reporting. That's 90% Jill Nixon, thank you. Strategize with Whatcom County Executive or their designee on advocacy. This year was one of the first years steering committee got involved in talking with some of our legislators and really sharing about some of the challenges, also some of the solutions we were seeking. Coordinate and conduct together with the Whatcom County Executive, assure the work of the task force, its composition, leadership, and membership, and communication to the public is informed by GARE's racial equity tool and other efforts to improve equity. So really what we're submitting in front of you today is this draft language, which would go into the record and then would be really kind of guidance to the steering committee on its role and what the task force would like it to do. I'll stop sharing there, and then Jack, if you have any questions or if anybody else has questions or comments, I'd be happy to see if I can answer them.
I do have a clarifying question. It may be for
Please.
Jill, or maybe for you, Mike, I'm not sure. So when you said this will go in the record, would this just be in the minutes for this meeting, or is this going to live in some fashion in some kind of document? For example, our rules of order or our guidelines or bylaws?
That's an excellent question, Jack. You know, in order to figure out what the steering committee was originally chartered with, I believe Jill Nixon had to go into minutes. So obviously it will go there, but I'm wondering if, and I might need the help of somebody who's a little bit more tuned into committee and task force processes to see if that is the best place. I mean, obviously we approve this. I do think this is getting voted on. Is that right, Jack?
It's scheduled to, and the reason I'm asking that, if it's going into the minutes, I think it's fine. I think if it's living longer, there might be a little bit of fine tuning. For example, I wouldn't put the years on the pyramid contract if it's going into something like that, but I'm not quite clear on where it's going. I mean, other than if it's in the minutes, I think it's fine, and that works well. This was approved as a document clarifying the role of the steering committee. Great. And then if it lives on at some other time into a document, we can address that at that time. Arlene, you've got a question?
Yeah, I'm wondering, is there something we should be not doing that we've been doing that's come out of this examination?
I don't think so. I think what Mike tried to do was actually capture and clarify what we're doing. As he mentioned,
Okay,
steering committee was originally formed. I remember well because Jill Bernstein, Ken Mann, and I did it because the challenge we had is many different groups came to us and members came to us asking for things to be on the agenda. And as individuals, we were like, well, how do we respond? And we're like, oh, we probably need to have a steering committee that addresses this holistically, that looks at it each time. So that's where it started. And I don't know that we ever thought it had to be limited to that. But that was the genesis of it.
okay. I mean, that's a big enough set of topics to deal with for sure.
Well, we very quickly realized we wanted subcommittee chairs there because when you're trying to figure out agendas and priorities, having that insight is really helpful. And I think that you can probably extrapolate where it's gone from there. So why don't we for now then approve it or have a motion to approve it as it is. It'll go into the record, it'll go into our minutes. And if it's captured somewhere else at a future time, it might be slightly modified or not. But I think that would that work for now, Mike?
Jack, that sounds like a great solution.
Okay, cool. All right, thank you. All right, so what we have then is we need a motion to, let's see, we would need a motion to accept the role of steering committee document as the clarification for the role of the steering committee as presented in the packet for the July 17th meeting. So hopefully that, hopefully Jill can gather that from the recording. Does that motion work for you, Mike? A motion to accept the role of the steering committee document to clarify the role of the steering committee is presented in the July 17th meeting packet.
That works.
Okay.
So
Do we have a second?
I'll second.
All right. Do we have discussion or questions? All right, seeing none, I'm going to ask for a decision. If you could either, what I will do is ask for you to verbally or visually give like a thumbs up or a hands up or an audio yes, and then I'll ask if there's any opposition and if there are any abstentions so we can clarify the record. So all in favor, please say aye.
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 All right, we'll let the hands come down. It's always bad to say, is anybody opposed? Well, the hands haven't gone down yet. They're coming down. All right. There we go. Heather, I'm waiting on yours. I don't think you're opposed. Okay, is anyone opposed? And Heather, I know your hand isn't opposed. Or I think I know that. I caught part of that. Can you, I don't think you speak again, please, if you are opposed. Okay, her hand is down. Okay, is anyone opposed? And does anyone wish to be recorded as an abstention? Seeing none, that motion passes unanimously, and that is approved. Thank you, Mike, and thanks for your efforts on that, for bringing it up. I know you've been working on this for a while now. Thank you for your effort there.
You bet.
Okay, committee update. So I think we're going to start with the joint behavioral health and legal justice system committees. And I'm not, are the chairs of both doing that? I'm not quite sure who's doing that. Does anyone know?
I think Arlene was prepared to speak on legal injustice. I don't know if she's able to do the joint as well, or Mike or Dan want to help out there.
Okay. Arlene, I'm just going to ask you, are you prepared to do the both? You want to start with legal injustice and maybe we can go back to the other one at the end and things that aren't.
Yeah, I'm prepared to do legal injustice, but not joint.
Okay, why don't we do legal injustice now? And then we're going to do joint at the end and we'll see that way the board chairs that are here can see perhaps what isn't covered. So let's start with legal injustice. That'd be great. Thank you.
Okay, on July 11th, Legal and Justice Committee met, and we had two primary topics. the most important one, of course, was Perry's report, which was very much like the report he gave to you today. So I don't need to summarize that, except to say in a general way that there's improvement in accepting referrals, and that there's still a little ways to go that we're wanting to have. But it was such a thorough report, and we appreciated all the data that was given. The second part of the committee was a discussion with Rajiv Majumdar and Doug Hildal. I'm not sure if I'm pronouncing it correctly, having to do with offender data and the difficulty of using offender data to inform law enforcement and the legal justice system what is going on with the records of people involved with those crimes. What was clear in the questioning was that there is very little communication between all the different systems. This may have to do with technology, or it may have to do with the fact that it's always been done this way, but it seems very difficult for them to get hold of information about the use of guns, the purchasing of guns, and those kinds of records. Also, there are certain problems that come with the systems that people are working in. So typically, the Native American community has jurisdiction over all their own information, and it's not accessible according to what was said at that meeting. So firearms purchase data and those kinds of records, there's just like a big zero in people's ability to use that information. There are no agreements regarding the sovereignty of Native American communities. There are different standards. So what, I mean, I don't know, Raylene, did you think that there was anything positive in the responses of the various people presenting?
I think it was just an expression of the challenges that are needed for getting all the information, whether it's pretrial processes for misdemeanors as well as felonies, or to post-conviction, that some of the data is not there, some of the data is inaccurate. Trying to collect the data is difficult. Some of the requirements that legislation has put forward is not being able to be kept up with by the parties that need the information to do their jobs effectively. And trying to get the tribal data was definitely an issue where there's some legal issues there. It's a sovereign nation, and I think there's some struggles to understand that from some people in the public, but I think it was good just to put that information out there. I also wanted to include that Alexandra Copeland with Bellingham Police Records was also involved. We did briefly discuss with her, there was an ability for the system to be able to track using the Crisis Stabilization Center, the Deacon Center of Hope, or referrals to MCOT. And she said it would be very difficult to input that data and pull it all off with the different silos and systems that are being used. So it's just I think there's always going to be ongoing struggles with getting accurate information to do the jobs that we want to do. And I think utilizing the index committee in the future and everybody's assistance in trying to input data due to some of the information from the Washington State Patrol stakeholders meeting, as they expressed that the numbers of information on individuals that were arrested and what the dispositions were are extremely low in the last couple of years. But they do know that some of that's due to COVID, booking restrictions, people not being booked on charges that they might have been before. That means they're not getting fingerprinted. That information's not being there. So it's just kind of an eye opener to individuals that, hey, we want to do a better job, but it's a struggle with all the silos that are involved.
Yeah, I think it was an excellent meeting, but like many of our meetings and reports, it reveals the gaps in the systems that need to be addressed. And so it was valuable for that reason.
All right, was there anything else? Are you ready for any questions? All right, are there any questions? Well, thank you for a thorough report, and we hope you got the heads up that we actually thought we would have committee reports today looking at the agenda, because we know they've been bumped for the last 4 months or so. So we appreciate it.
Jack,
Yeah, yes, really.
unless Perry or sorry, my brain just went away. Dan are available to assist us on the joint. I do have a summary here available if they would like me to proceed.
I think I can speak for them that they'd love for you to proceed. and I'm, yeah, I see some thumbs up and happiness that you're doing that, really. And we can also then invite them to add any comments. So that'd be great.
All right, so it was the June 13th joint meeting. We did discuss juvenile detention and behavioral health services. As we know, a lot of juveniles end up in jail once they become an adult. There's definitely an issue for 18 to 25-year-olds. Arlene discussed information on Touchstone Counseling Center in Blaine, that they were applied for a Department of Commerce grant, and Perry gave us a little more information on that. He said Touchstone was in the process of obtaining certification to provide substance use disorder services through the Department of Health. And he said that he understood the director's intent would be to use a recliner model, which would be incorporated into a 23-hour outpatient design. There's more information on that, I believe, in the packet if those are interested in it, but it would be nice if we could assist them in getting funding to be out there for the public and juveniles in there. Asap Paul Sidhu said that there was Whatcom County was investing in school programs to help prevent youth and young adults from incarceration through programs like Teen Court. Dan Hamill said there was a presentation on the last behavioral from Bonnie Schultz Lawrenson. I might have said that wrong, so my apologies, for Teen Court. Elfo also said that it would be nice if law enforcement, the Touchstone requested letters from law enforcement to support their grant application. Maya gave us information on 10 juveniles, 10 youths in juvenile detention. She shared that there is going to be meet with Northwest Youth Services and others to discuss the possibility of creating a youthful adult offender program that is peer-based, such as Teen Court. She said anything and any support would be appreciated. There was a special legislative session on controlled substance possession treatment, and Hamill began the discussion on lawmaking, making possession a gross misdemeanor. Eric Ritchie clarified the difference between a misdemeanor and gross misdemeanor. And we had some public comments, and that was kind of the gist of it, but there's more in there. If you guys want more, I can give you more, but I think I'll open it up to questions.
Perry,
Thanks, Raylene. Just wanted to let folks know that I did get notification of Touchstone's Youth Crisis Stabilization Center opening on the 17th of August. The location of the facility is at 103 West Main Street, Everson, Washington, 98247. So just wanted to pass along that information. I certainly plan on attending the opening, and I'm sure that anyone else that would like to attend would be embraced, learn more about that program.
thank you. Arlene?
Yeah, I'll be touring tomorrow, the facility. It's kind of amazing how it's come together really quickly. So I'll get to see the physical plant and the plans for it, and I'm happy to report back.
Great, thanks. Mike, and then Maya.
Jack, this is about the second part of that joint meeting that we had where it talked about the changes from the legislature. You know, when we discussed that at that meeting, that was so fresh. I think they had come back to session. Remember, they didn't pass it. And so they came back in May. And I'm just wondering, and I don't know if any of our members of law enforcement would care to speak to any observations that they've had since that has come to effect. But there were a couple of things that were very unclear at the time that we had that discussion. What impacts would it actually have? You can see in the comments under Sheriff Doug Chadwick was like, you know, some of this is pretty early, but we're probably going to need more capacity and diversion. So I don't know if it's within the scope of any of our members of law enforcement to discuss any changes or any observations they've had since that law is passed. But I remember that feeling very lacking at that meeting because we were just covering it so soon. And if not today, then we might take that to steering, Jack, and see about adding that to a future meeting.
Sounds great. Before I call on Maya, I need to apologize. Councilman Buchanan warned me he had another appointment and I was supposed to call on steering first, but yes, I can cover that, and I'm really sorry that I neglected to adjust the agenda accordingly. So I just wanted to say that while you were still here. So.
Oh, not a problem, Jack. Don't worry about it.
You don't mind me doing your report?
I know it's short. We've already covered 99% of it. So.
All right. Thank you so much. And I'm sorry that I forgot to do that.
No problem. Take care.
All right. Thank you. Okay. And did anybody want to comment? I'm sorry for that interruption, but I wanted to get that before I left. Did anybody want to respond Mike's question about whether things have changed? I think you asked Mike if anybody had seen some improvement.
Jack, just on that, I think we're going to have to, it's going to take a little bit of time to see the responses on that, how it's going to impact the small courts as well as Bellingham, jail restrictions, referrals. You can only refer so much when you don't have this facilities to refer them off to, how that's going to be tracked. That might also be something we want to see if the index committee can assist us on trying to figure out how to track that in the future. I don't know exactly how we're going to do that, but it might be something we want to look on. I don't know if Chief Tanksley or Eric Ritchie have any other comments on that, but I did see Maya's hand up, so she might have more information.
And that's perfect because Maya was next. I want to make sure we didn't forget about her.
Thanks. As to the diversion with the new statute, there is a serious lack of places for folks to be diverted to. And Eric Ritchie and I have been meeting to kind of talk about that, and we're meeting again later this morning and tomorrow with some law enforcement and others to kind of try to envision how this is going to unfold. But I wanted to circle back to the mention of teen court and trying to expand that into a diversionary program for youthful adult offenders. And we met last Thursday. I think there was a group of, let's see how many people were there. It was me, some folks from Northwest Youth Service, one professor from Western Washington University, Eric Sigmar from the Prosecuting Attorney's Office, and a couple other folks from my office, as well as Sophia Ray, who is right now an intern at City Council, but who is an avid participant in teen court, a great advocate for them. Anyway, we talked about sort of program ideas, and now I'm going to work with Jason McGill at Northwest Youth Services to see if we can find any funding to support someone to build out that model. So if I don't know, there was a presentation on teen court not long ago, so hopefully that concept is pretty fresh in everybody's minds. But the idea is to try to expand it to 18 to maybe 22-year-olds or 21-year-olds, kind of depending on what we can do. Using maybe students from Western Washington University or Whatcom Community College programs to serve as the peers for that program. So we're meeting and kind of brainstorming and trying to come up with ways to make this happen. It's kind of coming out of nothing. So hopefully you'll hear more about it, and anyone who wants to jump in and support that, I welcome your input. Thanks.
Thank you. All right, was there anything else? Okay. I got lost in the agenda. Let me pull that back up. Are we on steering maybe? I think we are. But before I do that, Perry, I know you gave a pretty robust, what could be called the Crisis Stabilization Center's committee update. Did you want to add anything, or was that good?
No, I think that the information that I provided is sufficient. The only thing that I'll add is that we also continue to work with law enforcement just in communicating information about the 12-hour law enforcement hold opportunity that there is at the Crisis Stabilization Center. I think that there's some real opportunities here, but there's also some considerations from law enforcement that need to be worked through and discussed. So I'll continue to bring that topic up and report on forward movement in that regard. Thanks, Jack.
Thank you. And Mike Parker, I'm pretty sure your hand's up from before, but if not, if you could unmute and ask any. Okay, yep, great. Okay, I think we're on potentially the last agenda item, which is the steering committee update. So, gosh, I hate to jinx us by threatening to end the meeting before the scheduled 11 o'clock time, but I think we're on track for that today. So, as Councilman Buchanan mentioned, a lot of what happened to the steering committee has been discussed. Our topics were, we had an update on the Justice Project, which he led the beginning of the meeting with. We talked about the drop-offs at the Deacon Center for Hope, which we've discussed at this meeting. The one bit of other business, a couple of things in other business that I'd like to mention so people know what we're talking about. We talked about the index committee and when that might come back, and I want to share a little bit about Stephen and my experience presenting to Bellingham City Council and County Council. We discussed the shortage of attorneys, Maya's information about that and how that's affecting our system. And that sort of ties into when Stephen and I presented to Bellingham City Council and the County Council, two of the areas they were very interested in were the competency challenges, how long people are waiting for competency, the recent court cases around that. And I would say it was an area, I know we can't fix this locally, but it certainly, I would say it was definitely an area of concern, and I would feel negligent not sharing back with you that the legislative bodies are very concerned about that. And what does that mean? And people are waiting that long, and that's, crazy. So I wanted to mention that definitely had their attention. And and also perhaps from a practical perspective, if there's anything that they can do to help with that log jam, I think there appeared to be a willingness to how can we help fix this? Is there anything we can do? There really seemed to be interest in that. There was interest in the county's plan to have 2 full-time employees working on data that would serve the needs of various decision-making bodies, including this one, to gather data that's useful to make decisions. My understanding is in the upcoming budget, there are 2 positions dedicated to that, and it's been an ongoing desire for many decision makers to have data that's useful in making important decisions. And I would say that information was well received. Other than that, our presentations went well. We're Bellingham City Council quite a while. They had a lot of questions. We were about an hour. County Council, we were there a while there too. They had a lot on the agenda that day. It was the 11th, so they had other things. But our reports went well, and that was done. And both I think he's off the call. Yeah, I don't see Mayor Fleetwood on anymore, but Seth or Mayor Fleetwood and Barry were or Councilor Buchanan were both very complimentary, and I want to share that with this body about our work and the work we're done. And actually, that reminds me, there was one other thing, if I could pull it up, because I said I would. Where is, let's see, here we go. We got, I don't know if all of you saw the email from Councilman Byrd, but I talked to him afterwards, and just this was in the context of the work we're doing. So I'll read just a little bit of it to make sure you've heard it. Public service is undoubtedly challenging, often leaving one feeling unrewarded. Your time and passion has helped create something with immense potential to benefit our community. I know none of you did this for personal gain, but for us, your friends and neighbors, and please be proud of the work you've done. I feel an overwhelming need to reach out and share my appreciation. Thank you for helping us make the sacrifices you've made in the countless hours of service and investment. So I think there's from my perspective, having been on a lot of these committees and boards through the years, a recognition that this particular group and the efforts we're doing in a wide variety of areas are having an actual impact, which is, I think probably one of the reasons many of us participate in these things. You want to make things better and have an impact. So I wanted to share that with you as well. I think that's all I've got for steering committee. Are there any questions? Raylene, I see your hand up. Probably the competency one. That's the topic that people are most interested in, I think.
Actually, both of them. One is on the public defense needs and shortages. I believe Maya's going to do a presentation at the next legal and justice meeting to kind of go over what the requirements are and what the struggles and problems we're currently facing. So for more information on that, stay tuned for Maya's presentation at the Legal and Justice Committee in August. On the second matter, I don't know if I can put Dave Freeman on the spot because I'm not sure if he's familiar with it because I haven't read the whole thing, but there was a recent Supreme Court ruling on competency that had lots of money involved in it. I didn't know if you could give any insight on that, Dave, or if we could postpone that for a later date.
I can only give the overview, which is this was the contempt, that's the True Blood contempt ruling, and Maya might be able to fill in more than I can actually, but essentially the court imposed $100 million contempt sanction on the state for failing to meet the requirements of the original contempt order. My understanding, and I have only had the chance to skim through it, but I think it does have some implications on civil beds as well, because I think it essentially says that the state should be using those for the criminal beds and meeting timelines there. And they've been dedicating some of that space to civil space. That could have an impact locally as well. So I wanted to bring that up, but I think Maya might have a better sense of this than I do.
Maya, would you like to address that? Or are you willing to?
As to the civil beds, they are limiting who can be taken in for civil commitment, and there's it's House Bill 1114, and they're folks, and they're described under 7105-280 subsection 3B. Those are folks that are charged with violent offenses. So those folks will still be eligible for civil commitment, but property crimes, that kind of stuff, would no longer be eligible for civil commitment. I've spoken or just communicated back and forth with Disability Rights Washington, and it sounds like they'll be figuring out how they're gonna distribute those funds, what kind of grants they're gonna make available, and I've notified the exec's office about that, and we'll be keeping an eye out, trying to take advantage of those funds. Just on a additional note, I mean, we have had locally just these local contempt rulings that are resulting in funds being deposited with the court, and it's unclear to me what the court is going to do with those funds. I'm hoping that Kayla and the exec's office will be connecting with the bench to try to discuss different ways that those funds could be used to better conditions for the True Blood class in our county.
Thanks so much. Anyone else on this topic or anything else with steering committee?
I forgot to add, Jack, that our numbers locally, as far as the wait times, from what I've seen in the last few weeks, have been improving slightly. I don't know if that has to do with the contempt finding. We are seeing some improvement recently. And the other thing I wanted to address is what Maya just brought up. This was a topic at our last judges meeting, I think last week. We do have some ideas. It's not a large pool of money. Although we have been issuing contempt in many cases, we have actually only seen a relatively small amount of funds come in based on those contempt rulings. I think we're somewhere around the $20,000 range. We do have some ideas from the bench as to how we would like to see that distributed, but it's a discussion that we're going to need to have with both the executive and members of some of the partner agencies. But our biggest concern right now is we're seeking a legal opinion as to our ability to kind of direct those in a specific manner. So we are seeking that before we bring it to task force.
Thank you so much.
Just to add, I think that number could really increase. I think there have been plenty of contempt rulings. They just haven't been reduced to judgment. And that is a very easy step to be taken. But it just hasn't been, because we have historically tried to do that and been told we're not the right people to do it. But we were successful recently. And so I think we can go back and do cases where the contempt was found and ask for judgment. I mean, there's the potential to garner quite a bit more money, I think.
And we have a process in place now, and I believe some of them have gone back. Those are signed by the presiding. So I actually haven't seen, other than current cases come before me with those reduced to judgment. But I suspect we're having a lot more come in through the presiding right now. So I agree, Maya, that we might be seeing more. There's certainly potential for a lot more. But again, we need to get that legal opinion as to how the bench can direct this if we can. And if that is possible, we do have some ideas to help benefit, I think, the system.
Okay. Were there any other comments, hands up, anything on this? All right, thanks everyone. I think I'm not aware of anything else on our agenda. We are in other business. So seeing nothing else, does anybody have anything that I've missed? I forgot to mention Stephen couldn't be here today. I guess that was obvious, but he asked me to give his, he's up in northern Canada, kayaking way up north in good weather. So he definitely couldn't be here on Zoom today. Jill, if you could assist us, please, with public comment, that would be great.
Yes, thank you. Also, right quick, I just want to remind everyone that this week's regular meetings of the Behavioral Health Committee and the Crisis Stabilization Center committees are canceled. For public comments, we do have a number of attendees today. If you would like to speak to the task force, please virtually raise your hand now. And we do have one hand raised. Go ahead, Dean.
Thank you. Dean White, resident of Bellingham. I just wanted to mention a concern that I have about at least my experience of a lack of discussion and conversation around the services and functions that the facility, the 23-hour crisis facility, will perform. I'm just concerned that we not repeat past mistakes. For example, the discussions we've had over the years around the uses and the function of the Crisis Stabilization Center. I know many of the challenges and issues resulted from there not being a common understanding at its initial creation years ago about what its function would be. Perry and the work of that committee have done a great deal to resolve and move those kinds of different views, work them through. But I think there's the potential to repeat that mistake of there not being a common consensus about the function of the facility. I know there's been a lot of discussion, but I think there are probably different forums that may have generated different understandings of what that new facility, for which we were going to receive $9 million, as I understand it, what it will actually do. And potentially, if there is passage of the referendum on the Justice Project, the notion of a behavioral care component to that initiative also, I think, may create a problem with people having a common understanding of what it will do and what its relationship would be to, for example, the crisis 23-hour crisis facility. And I just wanted to also commend to you an article in the New Yorker magazine from July 12th, describing something that some of you might already be familiar with, the empath model for emergency room or emergency response to mental health crises. It's called the Emergency Psychiatric Assessment, Treatment, and Healing Model. Apparently it's been around for 10 years and has a number of locations that's been implemented. So those are the concerns that I have, just that we start to talk more about function while we're creating a building that has a certain form.
Thank you so much, Dean. I appreciate your experience and perspective. I know you know a lot about those issues. Thank you. Executive Sadhu.
Yes. Hey, yeah, good morning, everybody. Sorry, I've been in and out and late in attending the meeting. I just wanted to say thank you. I think that very, very hard task and long hours, long days, long discussions since we started on this journey long time ago, but I don't want to count hours and days or years. I think that this is the best we could come up with. It is perfect. No, it's not perfect. It has all these things. It may not. We can do better, but we didn't want to be at the brink of falling apart. We could not, our community, ourselves living in here, every citizen, we could not afford that to let it fall apart. And all that work, the credit goes to IPRTF, individual members, individual discussions as a group to keep it together and listening to the community. There were so many diverse views. There still are so many diverse views. And I personally feel very personal gratitude to everybody. This office is not able to do this kind of work. There are so many different pressures on all of us. And but you have your credibility gained over since 2017 or 2015 actually, and you have used your credibility to bring this compromise. And we have this is just the beginning. We just putting Tom ballot on this idea on the ballot. A lot of work needs to be get done. Even passing the ballot, then still a lot more work need to get done. And I just wanted to share my gratitude to everybody. And so much discussion, so much useful discussion, so much learning has happened. Thank you. Thank you very much to everybody. Thank you.
Thank you, Executive. Are there any other attendees who would like to speak to the task force? Please virtually raise your hand now. And no more hands are raised. Mike Parker, I've got a quick question for you. If you have time to stay after, that would be great. Thank you.
Thank you, Jill. I do want to quickly say, Executive City, on behalf of the task force, thank you to you, the council office, Jill. I mean, all these departments and groups have come together and cooperate. We could never do our work without your support and the council's support and the city's support, you know, and all of the cities. So anyway, it's certainly been a pleasure, I think, to be involved for all of us that are actually seeing some results. Thank you. All right, well, with that, we're going to adjourn 32 minutes early. I hope that's okay. We look forward to seeing you next month. And thank you so much for participating today.